Just to kind of give the general overview first. So OSS Health Network is it's sort of our new brand, the new name. Orthopedic surgery specialist is gone, out the window, but we're keeping the acronym OSS because that's what the community knows us as. That term is used all the time. So it no longer stands for anything, but we're moving into OSS Health Network. And so this is the clinically integrated network side of everything. So Dr. Raven is the CEO. And then you've got your, here, I'll show you here. This is orthopedic surgery specialist and OSS physical and hand therapy. So we're combining those into this new company here. And this is the new logo. Our slogan, everything we do revolves around you. Around the patient. And so with this, we have acquired, a couple of urgent cares. We have Burbank Urgent Care in the Valley, and then we have East County Urgent Care in San Diego, which I believe you'll be doing a visit there with Omid in the next week or two. And so the whole goal with the clinically integrated network is to basically have a network of coordinated providers. They may be, there's several different ways that we're doing those relationships. Some might just be independent contractors. Some may come into our partnership with the doctors. Some may be, another physician group that we want to just, have a primary referral source to. But the whole goal is to provide, up to 90% of the patient's musculoskeletal health needs in their life under our umbrella, under our roof. So, right now we provide orthopedics and pain management, and physical and hand therapy and urgent care services. But really, we'd love to someday have, providers that are in the wellness sector, like chiropractic, nutritionists, et cetera. And then also have like cardiologists, rheumatologists, et cetera as well. So the whole goal is that we want to be able to coordinate our patients' care because we know that we have great value. And we know that we have great patient outcomes. And so the clinically integrated network is basically bringing those providers together and having a set core vision, a set core, policies, clinical protocols that everyone follows, so that we know that the care that we're giving and referring patients to are, of the best value around. And ultimately that then gives us leverage in negotiating contracts, in relationships and networking and growing as a business. So there's a lot of benefits there. And then the MSK-MSO company, California MSK-MSO, we specifically support this clinically integrated network. We may have clients down the road that are outside of that network, so we're not mutually exclusive to OSS necessarily. But they are our one and only client right now. And that California MSK-MSO was started in January 1st, 2021. And that basically provides all of the non-clinical support for this group and for all of the, future and upcoming providers. And so that's everything from business administration, financial support, marketing services, revenue cycle management, the billing, coding, collections, facility development and management, et cetera. And so now we have basically two functioning entities that are working together to basically support our patient community. So I won't go through all of this necessarily, but this is just pulled from the brand book, and we can actually have that. We can send you that brand book. It'll be really good for you actually to see, because you can use a lot of that likely in your work. But basically, this talks about kind of like the history of OSS. There's roots. The roots go back to 1947. There, was an original. The orthopedic physicians, Dr. Spears and Kistler, they sort of started a clinic in North Hollywood, added on, another 3 providers. So they had a group of 5 clinicians, and then they moved to the Burbank area. But they all, ended up retiring and whatnot. And so Dr. Burgess was the last of that group, and he brought on Dr. Stephen Yakubian, who was sort of the first of what OSS is now. And so he brought on Dr. Ray Raven. They were actually roommates in, I believe, medical school. And so they've known each other for, decades. And then they brought on Dr. Steve's brother, Dr. Shahan Yakubian, a couple years after. And then Dr. Michaela and Dr. Falkenstein came on board later on, about almost 10 years ago now. But they ended up forming a partnership, and they ended up forming One Tax ID in 2016 so that they can operate as a group setting, and they each specialize in a different, area of orthopedics. And so we're able to really provide well-rounded services in orthopedics there. And then we brought on Dr. Christina Jeter as our pain management specialist in January of 2021. She came from UCLA. So she came on board, and now we have pain management to offer as well. And we're looking to grow that service as well. So here you've got Dr. Steve Yakubian right in the center there, Dr. Shahan Yakubian to the right, and Dr. Ray Raven. And they are, we like to kind of informally refer to them as the senior partners, just because they've been around and they're a little bit more involved in some of the decisions for the business. And then Dr. Yuri Falkenstein and Dr. Mark McHale are partners as well. So the five of them here are our partners that manage and make the bigger decisions. Dr. Bastian is actually leaving us this week, but he started in 2019. He was a general orthopedic surgeon, did kind of a little bit of everything that these guys did, but he's in Glendale. And Dr. Jeter's in Glendale as well, but she's moving over to Burbank with our group as we move into the new building. So that way you can just sort of get familiar with their faces. We have physician assistants as well, and actually our nurse Cynthia just became a nurse practitioner, so she just passed her license, so she'll be coming on board. Once she gets her license and certificate, she'll hop into the NP role. But we actually now have, so Justin actually just left last week, and Emin left a couple months ago. So right now we've got Omar and Vaz, and they've been around for at least a decade. And they're great PAs. They assist in surgeries. They take on their own patient cases in the office, and they're really crucial to the practice. So adding Cynthia will help. Cynthia, our nurse practitioner, will be more involved with perioperative services, post-op calls and visits, and then these PAs can support the doctors more in surgeries. So OSS, one second. OSS Health Network. So the big idea here, which we talked to you about this in some of your interviews and just our conversations before this, but again, the slogan here, it's the one place where everything we do revolves around you. The whole idea here is coordination of care. We believe in value-based care, not just because it gets us good contracts, which sometimes it doesn't necessarily, but because the outcomes are truly what matters, and it's what keeps our patients coming back to us, as well as referring families and friends and the whole community. And the doctors have been practicing under this in this setting for the past couple decades, and they've seen patients they had 10, 20 years ago come back with their child now, and their child has like a fracture or something, and then their grandma needs a hip replacement, so they bring their grandma. So it's a very familial environment and culture that we are proud to have, and are now working harder to implement that and integrate that and continue that family culture while we continue to grow. And I think that's going to be one of our bigger internal challenges is keeping that family dynamic when you just keep expanding. And I know that that can be a hesitation with a lot of the staff or with a lot of the doctors that feel like we're going to become corporate or something, something like that. But the whole idea with this network is that the providers and offices have some autonomy. They have some independence. They're not necessarily governed by a hospital administration with a bunch of red tape and everything that you gotta get through. So that's the idea. And so this talks a little bit more about the vision. We really want to have an integrated wellness center as I said before, we have physical hand therapy, but we've talked about home health with you. We really want to be able to step into that field. Maybe we don't need to, really control it or take over the market by any means, because there's a lot of competition there. But I think we do want to have a hand in it, especially for our surgery patients, especially for the patients at the hospitals and our surgery center that need that assistance and aren't getting good home health care in other areas. So, but also, nutrition, I mentioned that, chiropractor services, massage therapy, etc. We want to really be able to offer a little bit of everything. And it might change for each market that we serve, what services are going to benefit that market more. So that's what we're, continuing to assess, and you'll be involved in a lot of that as well, I'm sure. Yeah. So yeah, this kind of gives us like our purpose, mission, and vision. The purpose is really to provide personalized musculoskeletal services that are comprehensive in nature. So if a patient needs to go get x-rays, we have that in-house. If they need to do an epidural injection, we can do that, right in the room next door to where they're seeing the doctor. If they come into the urgent care with a fracture, the urgent care says, this is actually an orthopedic case. We're going to, refer you over to the ortho office there, and they'll assess everything. But the goal is really just to provide that high quality care and the best experience for our patients. And hopefully we can provide that convenience and the ease of access for patients, instead of having to refer them every, which way and in different directions and in different offices to get the care, when they can get it all under one roof. So that's the goal there. So this just sort of breaks down some of the different entities going on and that are involved in our work currently. Up here at the top, you'll see MedBridge, and MedBridge is the management company that has been supporting OSS since about 2015. They deal specifically with ambulatory surgery centers. So physician practices, while they have some experience, it's not necessarily their wheelhouse. And so that's actually how I, came to OSS originally myself. I was actually with MedBridge at the time, and in 2000, it was the end of 2020, OSS was looking for someone full time, and I kind of made that transition into the physician practice group setting. And so right now what we're doing is we're kind of in the last few phases of transitioning MedBridge's services all in-house into California MSK MSO. And so what we've done is, in a way kind of replicated or mimicked MedBridge's model of providing that like non-clinical support and services for healthcare providers. But we're doing it for basically all of the ancillary services outside of the surgery center setting. So MedBridge will continue to manage our two ambulatory surgery centers, which are down here, Buena Vista Surgery Center and Glendale Surgical Center. So those are surgery centers that the partners and MedBridge have ownership interest in. And Glendale Surgical Center is our most, profitable surgery center. Buena Vista is kind of like an overflow sister center. So MedBridge will still be involved with those, but most of the day-to-day is all, moving over to California MSK MSO now. We know, now we have HR in-house, we're bringing accounting in-house, credentialing is now in-house, etc. So soon here, MedBridge will kind of be off to the side a little bit. And we'll still use them for consulting purposes. They have an in-house counsel that we use for some legal items, and they can help us as well with some bigger projects. One great thing about our relationship with MedBridge is that, down the road, we may have doctors or providers that are looking to have a surgery center. And when that happens, we go to Dave Odell, who's the CEO of MedBridge, and he and Dr. Raven have a really good relationship and a long-standing relationship. But there's sort of a good benefit there that if there's a surgery center we want to develop, MedBridge can, either find one for us to lease, or they can build one from the ground up and get it, accredited and all of that and get it up and running. So it's a really great relationship that we're thankful to have. So they'll still be involved to some degree, just less and less as time goes on. And then we've got Burbank Urgent Care here as well. They were acquired in, I want to say, February or March of 2021. So the senior partners, Dr. Raven, Dr. Steve, and Shahan Yakubian, they went in and they actually bought the building that we're going to be moving into at the end of this year. And then the partners acquired the urgent care as well. I'm sorry, the three senior partners acquired the urgent care as well.
They work at hospitals, or are they mostly just in the clinics?
They work at hospitals, so they have privileges at Providence St. Joseph, and they had them at Glendale Adventist, but they don't really go to, they do mostly Providence and Burbank. We're also looking at Glendale Memorial as well. Our physician who's leaving us this week, he's been in Glendale, so he's been really involved with Adventists there. And so they've sort of let him continue those relationships, and they're pretty strictly part of Providence, and they're really they play really important roles at Providence. They have led like the orthopedic division, and they've been really involved in helping the hospital with decisions, and we've got a really good longstanding relationship with that hospital. We've been in talks just about, systems and having the hospital help us with, various projects. And the goal is to keep that relationship, but with hospitals, it's never a quick, it's never quick. It's a very long process with lots of conversations.
Yeah.
Yeah. So, but they're really involved with Providence.
Cool.
Yeah, and the urgent care, actually, you'll learn more from Omid about the urgent care, but they are, I think Sarah, their executive business manager, she was saying there's something like 15,000 urgent cares in the nation, and Burbank Urgent Care is within the top 2% of acuity. So they really see their doctors are ER doctors, so they're ER trained, so they really see a lot of a big variety of cases in there. And the goal is to really, help prevent patients needing to go to the hospital. So that's kind of one advantage that we like to.
That's the number one thing with hospitals. If you could prevent readmissions, that's all I care about. As long as you can prevent the readmission rate.
Right, because it's so expensive for both the patient and the hospital. I mean, it's an expensive business there. So we're hoping that payers will, see that or start to see that and help us out a little bit. But those conversations have just begun, and, it's going to be some time before we make any movement there. But just so you know, we're looking to roll out this brand in October, likely mid-October. We'll do sort of both an internal and external campaign. And the move to the new building is happening the end of this year. December, we'll be starting to slowly move in. And I think our first week of services will begin in January, that first week of January after the new year. So we're trying to see if we can move in our physical and hand therapy department sooner, but it just depends on, everything they have to do with inspections and the fire department, and that can take time. So we're not we're planning to be ready, but we're expecting that it'll be end of the year. We don't have high hopes. So that's a little bit about the two entities, and then also just the different players involved here. Right now we're looking to expand more immediately in some surrounding areas, like Orange County, San Diego, Santa Clarita, or Lancaster, Palmdale. And we've had some opportunities and have pursued some, and decided it's just not the right time. But we're always looking for opportunities there. Dr. Raven is definitely the visionary and entrepreneurial. He's really brought OSS in a business sense to where it is today. And then Dr. Steve and Dr. Shahan and the other partners have been involved in really their relationship building with like the hospitals and other providers have been really crucial as well. Yeah, but we're looking to expand, and whether that's satellite offices, taking our model and trying to scale it. I think that may be something that we're, looking at doing in San Diego with that East County urgent care. I think the goal is to have, an orthopedic doctor paired with an urgent care and, try to use that model. And that's something that isn't really being done very much. And so that's something that they've found some benefits there, and there's some interest in sort of using that as a healthcare just business model to provide.
And the orthopedic doctor runs the urgent care, or he kind of oversees it?
No, they'll have the urgent care docs there. I think the East County urgent care, I don't know if those doctors are ER trained or not, but Dr. Stanford Lee, who's the director of the urgent care, the medical director and doctor at Burbank Urgent Care, he's ER trained, and he actually just became the medical director for East County Urgent Care. Yeah. So he's starting to go down there and, kind of help continue to train their providers and everything. And then the goal is to have an ortho doc or clinic or PA that's tied to it. So they're not necessarily overseeing it, but referral source, having just an ortho doc that is involved and can provide services both, I think, in the urgent care and then also in their own clinic as well. So when they get a patient that comes in, it's like, oh, you've got a fracture, our ortho doc will treat you, and then you'll have all your follow-ups at his clinic. So that's the idea there.
Huh. All right.
Yeah. Let's see. Any questions about the the specific companies involved or?
No, not really. I'm getting a good idea.
And they'll come and we're really, it's been a little confusing for everyone because we have two different companies, but everyone's kind of involved with both, and so it's hard to tell when something is the MSO versus when it should be the clinically integrated network. And so we're slowly kind of, they're very integrated right now, and they'll continue to be, but we're kind of slowly pulling out.
Trying to get one brand, putting everything together. Yeah, and it's a lot easier for people to do, because when I had a market, sometimes it was the same company with 3 different names. One did like a home health, one did a hospice, but they were different names. So it was so hard to market when I was like, well, they're still one company, but they're going to stay in Corey. Well, why are the names different and all this stuff? So it just didn't look good. So now that it's one name, it just makes everything a lot easier, especially with the marketing.
Yeah, no, that's right. And and just internally, our own protocols and policies and everything, you've got to separate them out. And so I think the idea with us having, sort of an executive leadership team with the MSO now, Dr. Raven, who's the chief visionary officer of MSO, he can kind of remain as the visionary officer, and start to actually, get into all the projects that he's been wanting to do for years with the actual clinic network itself, developing protocols and, streamlining operations with the actual clinical providers and policies related to that. So the idea is that he'll, continue to obviously oversee the MSO and be involved, but have a little bit more of a silent seat, if you will, so to speak, from the day-to-day things, and leave those up to, Omid and myself, and then, kind of get more involved in moving forward with the clinic projects. So, yeah, we've got a team of about, well, right now our employee count, actually, Mike, you might have a more accurate number now that we've added East County, but I think we're around 150, 160.
Mike.
There we go. Yeah, so with we're at 135, and then East County Urgent Care is bringing over 26, so 151.
151, yeah, there you go, about 150. So yeah, with that, the model for that, this may not be too crucial. I don't know if this will be important for you to know, but it's helpful just to envision. Basically, everyone is hired under the MSO, So the MSO also acts as an asset management company. So any like major equipment or building leases, things like that, the MSO will sort of take on and assume liability, but then we'll lease those back to the practices. So for example, the employees are hired under the MSO and then leased back to the practice, you know, dollar for dollar, except for the clinical providers. The clinical providers, by law in California, you know, part of medical corporations, they are actually, they need to be under the practice itself. They can't be fully managed by a management organization. So, yeah, so that's sort of how that works.
Cool.
Yeah. Trying to think if there's anything else here.